Dr. Dusty Linnell, Associate Professor of Practice, Family and Community Health, and Evie Smith, Small Farms and Master Gardeners Coordinator. Also, there is input on this presentation from program partners Renee Johnson and Wiley Thompson. Their talk title is Working Collaboratively to Improve Community Resilience, Inclusion, and Equity.
Hi there. We are here to talk about Juntos en Colaboración. And we are a group of people working together as extension professionals and community collaborators to increase resiliency among Latino, Hispanic, and Mesoamerican indigenous people in Lincoln County. We first came together in 2020 in response to the COVID-19 crisis. I'd like to take a moment and ask you to remember what that was like. People got sick, many people died, and the whole world shut down. We started washing cereal boxes and milk containers. We hoarded toilet paper. We had to isolate in our homes, and we couldn't be with our loved ones. Parents became teachers, some businesses closed, and some people lost their jobs. We were scared, often confused, sometimes angry. We didn't know if the information we were getting was right, and we didn't know what was going to happen next. And that's what it was like for those of us who speak English and could understand what the news and the public health experts were telling us about how to protect ourselves and what to do when we needed help. So I'd like you now to consider what that was like for people in our communities who don't speak English very well. In June of 2020, 124 people at a seafood processing plant tested positive for COVID on one day. Many of those people didn't speak English very well. They spoke predominantly Spanish and Mam, language of the Mayan people. And suddenly 124 people needed a whole lot of information. So we formed Juntos en Colaboración to be able to respond. And what we did was we listened to community members. They asked, how do we get a COVID test? How do we protect ourselves? What do we do when we get sick and we have to quarantine and we can't work and we can't pay the bills or we can't get any food? And so what we did is we gathered as many community members and community partners as we could to develop more than 30 videos to answer their questions. We posted them on YouTube, and we got more than 3,000 views.
After that, we widened our scope, looking for other opportunities to increase access to programs and services and build community resilience for future crises. We listened to community members through community listening sessions and through needs assessments, and we identified 3 focus areas for our work. The first one was a health system with increased access for Spanish and Mam speakers. Next was a more secure food system for people with Central and South American cultural traditions. And finally, a gathering place where community members could come together and feel less isolated. We engaged with community members to identify projects, and we worked with partners, both internal and external to our organization, to develop solutions. This involved working with almost the entire Lincoln County Extension office, including our office manager, small farms, master gardeners, 4-H, SNAP education, family and community health, and our regional director. We also collaborated with community partners, including the OSU Center for Health Innovation, Lincoln County Public Health Team, a local nonprofit, and public health workers. Through our work together, we were able to make meaningful impacts in our community, including videos in Spanish and Mam with information about COVID, vaccination clinics tailored to the needs of our community gardening spaces, and a cultural center where members of the Mesoamerican, indigenous, and Latinx community could come together to connect with resources and with each other. Today, we're going to share 2 examples of our work.
So the first example we're going to talk about is how we work together to create tailored vaccine clinics for COVID-19. In early 2021, when the vaccines were first available and they were being administered through mass vaccination clinics, many of our team volunteered to help. And they were being held at the fairgrounds, and more than 500 people were being vaccinated every day. But we started to notice that there were people in our community who were Latino, Hispanic, and Mesoamerican indigenous people who were not accessing those vaccines. And so once again, we listened to our community members, and we learned that there were some critical barriers preventing their access. The clinics were held Monday through Friday between 9 and 5. And that's a time when most people worked. The appointments required an email address to sign up, and lots of people in the community didn't have email addresses. And even though the vaccines were free, some of the paperwork that people had to complete when they got to the appointments made it seem like medical insurance was required, and so they were walking away. And so what we did again was we gathered community members and community partners, and we created vaccine clinics that people wanted to be at. And what we created was clinics that looked more like a fiesta than a vaccine clinic. There was food, and there was music, and a celebratory atmosphere. We also partnered with local community members, like grocery store owners, to host vaccine clinics on Friday nights. And the reason we did that was because people would often gather at the grocery store on Friday nights to cash their paychecks after work. So we thought, why not bring the vaccines to where people would already be? We also hosted vaccine clinics in partnership with cultural festivals like Cinco de Mayo and La Fiesta Latina, hosted by our SNAP Ed team in partnership with the county fair. Oops. Since March of 2021, we have increased health access by bringing research-tested public health practices to increase access to these vaccines to 2,311 people at 42 clinics.
As we listened to the community, it became increasingly clear that access to space to grow food, especially food that was familiar, was an important issue. Many community members immigrated from places where they had access to land to grow food, and they had deep knowledge of how to grow foods that are important for them, like chile cayote, which is a large squash that's usually preserved in honey as a sweet, and epazote, which is an herb that's usually cooked with beans, in subtropical Guatemala. However, in Newport, Oregon, where the average high temperature in the summer is 60 degrees, these community members told us that growing these vegetables and plants that usually do well in humid, hot climates was a challenge. So we engaged with community members through a needs assessment and through one-on-one conversations, and we heard from members of the Mesoamerican, indigenous, and Latinx community that they wanted a community garden where they could connect with each other and where they could grow foods that were important for them. So we started working collaboratively with community partners. We reached out to Lincoln County, and they provided temporary gardening space at the Lincoln County Commons, which is our fairgrounds. We reached out to the OSU Center for Health Innovation, and they provided funding for supplies. In 2021, we built 16 raised beds at the Lincoln County Commons. We leaned on our team members that work closely with these community members, and they started inviting folks to the garden. In 2022, we built 13 more raised beds. The Master Gardeners hosted cloche building and use workshops, and the chile cayote grew. In 2021, we got grant funding from the Danone Institute to increase access to gardening spaces for members of historically underserved communities in the northern part of the county. So we're currently in the process of building or renovating 5 new community gardens in Lincoln City. As a result of our work, 39 families are growing food in community with each other to feed their bodies and souls.
And so it's not because the individual expertise that each of us in Extension brought to this, it's because we work together with the community to achieve these impacts. And all of us in Extension can continue to increase access to programs and to build community resilience by, oh, we're missing a slide there, sorry, by listening to community members to identify the problems, to engage with community members in creating solutions, and to work together across Extension programs and with our community collaborators.
Together in collaboration.
Juntos en colaboración.
Thank you both. That was fantastic. I love to see those examples of collaboration, and especially when we talk about cultural competence. So in keeping with time, I want to give a chance for 2 questions so that we can keep it rolling. Rebecca and Janine are staffing our microphones if anybody has any questions for our speakers.
We're inviting our team members, Wiley Thompson and Renee Johnson, to join us.
Any questions?
Great job. Impressive. So my question is about your strategy for language. So you had people that spoke indigenous languages, you had Latinx people. So how did you strategize to be able to communicate across that many languages?
So what we did is we had members of the community communicate. So we could work on our Spanish. We did have some teammates that spoke Spanish, but the hardest access was for mom, and we employed members of the community to make the mom videos, which was really big. So it's like your neighbor making a video about something that you need to know. You're going to trust that more. So not only was the language true and pure spoken by a member of the community, but it was someone you knew. The big gringo could talk, but I mean, come on, it would be awkward. But we kind of expanded that. Is Beatrice here? Beatrice? So she was a secret shopper. She's way in the back hiding because another important thing was the hospital said they had a Spanish language line for access. And so Beatrice was kind of like a secret shopper, and she called up, she's like, oh, I have, a problem. But she's like in Spanish. And they would just didn't they just put you on hold and just set the phone down and walk away? It was no good, but there was a county commissioner with Beatrice listening. And so we called them on their stuff. And so it was, again, our theme about creating access. And whether it's how to get married or how to pay your bill, if it's only in English and the person just walks away, then the narrative becomes, well, that person is a deadbeat, they're not paying their bill. No, they just didn't have the access that we had. And so that's kind of our approach. It's all about access. Sorry, that was a long answer.